Good day everyone, my name is Jamellah Palalisan. So I will be sharing with you guys the story of LYDIA Hall, a remarkable nurse who made a big impact on healthcare. So basically, LYDIA Hall was born on September 21, 1906 in New York City as Lydia Eloise Williams. She was the eldest child of Louis V. Williams and Anna Catherine Williams, and was named after her maternal grandmother. Her brother, Henry, was several years younger. At a young age, her family decided to move to York, Pennsylvania, where her father was a general practice physician. LYDIA Hall graduated from York Hospital School of Nursing in 1927 with a diploma in nursing. However, she felt as if she needed more education, so she entered Teachers College at Columbia University in New York and earned a Bachelor of Science degree in Public Health Nursing in 1932. After several years in clinical practice, she resumed her education and received a master's degree in the teaching of natural life sciences from Columbia University in 1942. Later, she pursued a doctorate and completed all the requirements except for the dissertation. Lydia Eloise Hall was a nursing theorist who developed the care-cure-core model of nursing. Her theory defined nursing as participation in care, core and cure aspect of patient care, where care is the sole function of nurses, whereas the core and cure are shared with other members of the health team. She was an innovator, motivator, mentor to all nurses in all phases of their careers, and as an advocate for chronically ill patients, she worked to involve the community in public health issues. LYDIA Hall started her career as a registered nurse at the Life Extension Institute in Pennsylvania in New York City, where the focus was on preventive health. She then worked for the New York Heart Association and later for the Visiting Nurses Association of New York City. These experiences gave her strong skills in public health and community involvement. In 1950, she became a professor at Columbia University's Teachers College, where she taught nursing students to act as medical consultants. She also did research in cardiovascular disease, but her true passion was helping chronically ill patients. This led her to develop her famous care-cure-core theory, which explained the important role nurses play in patient recovery and overall well-being. In 1957, she helped establish the Loeb Center for Nursing and Rehabilitation at Montefiore Medical Center in New York. As the first director, she made sure nurses were in charge of daily patient care, and the results were amazing. Patients recovered faster and their hospital stay was cut almost in half. Under her leadership, the Loeb Center became a model for nursing-led care, inspiring many other centers across the United States and Canada. Throughout her career, LYDIA Hall worked in clinical nursing, teaching, researchers, and leadership. She also published more than 20 works about her theory, leaving behind a legacy that continues to influence nursing today. So to sum it up, LYDIA Hall showed us that nursing is just not about treatment anymore, but also about truly caring for patients and guiding them throughout their
Let's
recovery.
proceed to LYDIA Hall Care, Cure, and Core Theory. It's a nursing theory developed in 1960s. It focuses on the three interrelated aspects of nursing. Care is the nurturing component. It mostly provided by the nurses. The cure naman is the treatment of illness or diseases. It often shared with the doctors and other medical professionals. And lastly, the person or the core. The person or the patient themselves, including emotional and spiritual needs. For example, may scenario dito tayo, the post-operative care for an elderly hip replacement of the patient. The care component here is that nurses helps the patient with daily hygiene, eating, and comfort. It provides emotional supports and reassurance, especially if the patient is anxious or oriented after surgery. Nurses must listen actively to the patient's concerns and treats them with dignity and respect. The care focuses on hands-on physical and emotional care that promotes well-being and healing. And then the cure. The cure or the nurses administers medication as prescribed. For example, painkillers, antibiotics, monitoring vital signs, and surgical sites for infection. It collaborates with the healthcare team. For example, yung surgeons and physiotherapists for for treatment planning and rehabilitation. It focuses in managing medical conditions and ensuring their recovery. And lastly, the core. The core here is that nurses talks to the patients about their goal after recovery. For example, kunyari kung mag-return sila sa home nila, and kunyari kung hindi sila makalakad and then gina-comfort mo sila. It supports the patient's psychosocial and spiritual needs. For example, fear of losing independence or coping with aging. It focusing on helping them address the patient's emotional, social, and psychological needs.
So let's proceed to the major role of the care-cure core theory. The individual, health, social and environmental, and the nursing. So first is the individual. Individual is a unique, complex human being with a physical, emotional, and social, spiritual. Not just a patient with the disease, but a person with thoughts, feelings, values, experiences, and goals. Someone who is capable of self-healing, decision-making, and growth when properly supported. Health. Hall believe that health is more than just the absence of disease. It is also about the integration of the body, the mind, and the spirit. Health includes being physically comfortable, clean, and free from suffering. The nurse supports health by providing basic needs like hygiene, nutrition, and pain management. Even if a patient has a chronic illness, meeting these needs enhance their quality of life, which is a vital part of being healthy. Health here means physical comfort, dignity, and feeling of being cared for. Lydia Hall viewed health as a multidimensional concept that can't be separated into parts. It is about more than curing diseases. It includes helping people feel safe and understood, being comfortable in their bodies, making meaningful choices, and growing emotionally and spiritually. Society. Society influences the individual's health beliefs, behaviors, and resources, while the environment includes the physical, psychological, and social surroundings where the patient lives and receives care. Society is the social context influencing the individual's health and behaviors. Assessing social support, cultural beliefs, economic factors involving family or community in care. Environment naman is the physical and psychosocial setting of care and creating safe, comfortable spaces, adapting care plans based on patient's living condition. Though it's not explicitly outlined as major concept in Lydia Hall's theory, but society and environment are underlying factors that influence the core or the individual and impact on how nurses deliver care and cure. Understanding this helps provide holistic patient-centered nursing. So lastly, the nursing. In Lydia Hall's theory, nursing is seen as holistic practice involving the art of nurturing or the care, the science of treating diseases or the cure, the support of the individual's growth and self-awareness, the core. The three major nursing roles according to Hall components are the care or the nurturer. It provides the physical and emotional comfort of the patient. Empathy, compassion, dapat hands-on care ka dito. Yung nurses, core or the facilitator or counselor, it supports the self-awareness and emotional health. Need dito is communication, counseling the patients, and just communicating with the patient. Cure naman, or the technician or collaborator. Cure, manage the medical treatment and recovering clinical skills, medical knowledge, and it also involves teamwork, of course, for curing. Nursing is multi-dimensional and dynamic. It involves physical care, emotional support, and technical expertise. The nurse adapts their role based on the patient's needs and at any given time. This approach humanizes nursing, balancing science and art. Nursing is ultimately centered on the person or the core, not just the illness. So let's proceed to Hall's Care Cure Core Theory Circles.
The care circle theory explains that nurses' main responsibility is nurturing patients. This means giving care or comfort and guidance, similar to how a mother nurtures her child. Nurses provided basic care like helping patients eat, bath, dress, and stay clean. Gina-aim gid ng nurse to keep them comfortable. Aside from physical care, nurses also teach and support patients, especially with needs they can't manage alone. Through this, a close relationship can form where patients feel safe to share their thoughts and emotions with the nurses. The core circle here in Hall's theory, the core is the patient. The patient set their own goals and make choices based on the other feelings and values. Nurses support this by focusing not just on physical needs, but also on the patient's social, emotional, spiritual, and intellectual needs. The nurse help the patient talk about their feelings regarding their illness and its effects. By reflecting these feelings back like a mirror, the nurse help the patient understand themselves better. This self-awareness allows the patient to discover their motivations, make clearer decisions, and grow in maturity. In short, yung core is gina-highlight niya yung inner self and values ng patients and also yung emotions ng patients. And then yung mga nurses, ang role nila is to guide reflection so that the patient can understand their own feelings and for them to make their own decision as well. The cure circle, in this theory, the cure refers to the medical side of nursing, like giving medications, treatments, and other procedures to help heal the patient. Nurses don't work alone here. They share the role with doctors, therapists, and other health professionals. The three circle here, so the care, cure, and the core work together and may shift in importance depending on the patient's condition. The nurses takes part in all three. In the care circle, the nurses helps with daily needs, for example, eating, bathing, toileting. In the cure circle naman, the nurses uses medical knowledge to treat illness. The core circle naman is the nurse supports the patient's emotional, social, and spiritual need. In short, yung cure is medical treatment and intervention shared with other health professionals, while the nurses balances all three circles to give complete care. Kaya mas malaki yung circle ng cure kasi mas malaki yung ginagawa ng cure. Okay? So again, Hall's Care Cure Core Theory says that healing mainly comes from the patient's own inner strength and motivation, not just from the healthcare team. Number 2, the three parts of nursing, care, cure, and core are connected and work together, not separately. Number 3 naman, these three parts change in importance depending on the patient's condition and progress. Now, sa conclusion, so kayo na bahala magbasa ng conclusion. Thank you. Bye. Good night.